What should my return to work policy look like for my employees, whether they fall into several categories, if they've tested positive themselves or if they've been diagnosed symptomatically but not actually tested, or perhaps they lived with or took care of someone that was diagnosed or tested positive. What should our policy look like when we do have, even for, again, it's a segmented thing here, it's a dual question. You have the essentials who this should be something that is practiced right now. And then of course you have those that are, trying to make best practices when they enter back into their work environment. Do you have any suggestions that, businesses might be able to start looking at to do a little bit better planning and, like Dr. Chung had referenced, do some risk assessment and making sure that we have those plans in place?
Sure. We've absolutely got to make sure that people are healthy before they return to work, or we will have another resurgence. So, we don't have another hour to answer this question, Beth, but I will tell you the return to work scenarios are complicated based upon the availability of tests. So there's test-based methods to get folks back to work, to negative tests apart from each other. We can't get tests to diagnose once. So there's a test-based method, there's a non-test-based method that largely applies to folks that are have been diagnosed positive based on symptoms or tested positive. There's strategies there to look for the resolution of symptoms and counting number of days fever-free, but there's a gap in return to work information for folks that have lived with someone who's been diagnosed positive. They may be asymptomatic themselves, but when do you start counting their 14-day period seems to be a subject of global disarray. So the World Health Organization has one metric, the National Health Service in the UK has a different metric. Our own CDC seems to be a little silent on that issue. So return to work is absolutely developing. We're trying to stay on top of that. The CDC, again, does have good guidelines if you've been diagnosed positive or if you've had one exposure and you've left that exposure, they want you to quarantine for 14 days. But if you have lived with or taken care of someone who's positive, the guidance is a little unclear at this point.
Thank you. Yeah, I think that comes down to a number of different questions is where do you go to your sources to get that information? So I appreciate you summarizing that and giving a real good indication as to the non-test versus test method, symptomology, and how long they've been exposed, et cetera. And thank you. Dr. Chung, do you have anything else to add to that particular answer?
Right, and I will say there's still a lot of uncertainties. We've said it repeatedly that there are folks who may be asymptomatic who are cases. So you kind of have to be cautious and use your best judgment. And the other part is that of those cases, let's say they were diagnosed, the viral shedding period appears fairly long. And some of the studies, although we don't have huge amounts of studies, they may be shedding for about 3 weeks or more after they became symptomatic. And then there's the pre-symptomatic stage. So it may be a month, altogether that these cases may be shedding. So, we have to use our best judgment. We have to stay updated on the science and apply the science appropriately, really for public health measures and public health management.